After United Healthcare CEO killing, doctors speak out.
After Brian Thompson, the CEO of United Healthcare, was killed in New York City, we saw a huge outpouring of anger directed toward health insurance companies. The vitriol and the scale of the response was shocking to many.
Shocking? I don't understand who was shocked by this. I feel like it should have been expected, rather.
We wanted to hear from doctors who deal with patients and insurers on a day-to-day basis. Have you been surprised by the response?
I think I have and I haven't. I mean, I certainly feel the undertones from my patients, the anger at my staff that they can't do something right away, but surprised at the amount of support there is for obviously something that's inappropriate and shouldn't have ever happened.
I'm not surprised, to be honest. I'm not always able to give my patients the care they need.
What is the worst thing you have to deal with from an insurance perspective?
Hmm. I mean, no one's saying that what he did was the right thing. It's like I was saying earlier to someone. Sometimes you can be, sometimes you could be correct doesn't mean you're doing the right. It doesn't mean you're good. And likewise, being incorrect doesn't automatically mean you're bad. You could also be good. Anyway,
The worst thing that we have to deal with from the standpoint of the patients is pre-authorizations.
Prior authorization means that the insurer has to approve whatever medical procedure that your doctor thinks you need.
Nearly all doctors surveyed by the American Medical Association said that prior authorization requirements have delayed access to necessary care.
It's something that pretty much didn't even exist when I started practice decades ago.
Instead of us being able to spend time in the office with our patients, we're wasting that time with insurance companies.
Now we have entire teams dedicated just to the non-clinical administrative side of our practice.
that's a thing. They have an entire. Oh my goodness, bro. So not only do doctors have to worry about paying basically paying themselves and paying their staff, but now they also have to worry about legal fees and paying uh what amounts to a bunch of accountants. You know what this sounds like to me? It sounds like you either become a corporation in America or you get stepped on and ran over. Because if doctors need their own set of lawyers and accountants and whatnot, then what do you expect from every single business? That means every single business. If a simple business model, as it is to basically be a doctor, it shouldn't be. It's being a doctor should not require bureaucracy, and the fact that it does speaks volumes about the kind of system we live in.
That wasn't there when I started 10 years ago.
Another pain point can come after the care is rendered. Sometimes the care is given and then the insurer decides, in retrospect perhaps, that it wasn't justified or it doesn't fit the plan and shouldn't be paid for.
So what we see in healthcare workers is people get demoralized, people leave the business.
It's a huge financial and emotional burden.
And it can impact a patient's care. 1 in 4 doctors said that prior authorization led to a serious or life-threatening medical issue.
I had a patient, she had a history of breast cancer. She had a double mastectomy. Several years later, she started getting pain in her chest, and the appropriate test for her, unquestionably, was a CT scan. I ordered the test. It was denied by her health insurance company. It was a delay until she actually got the test she needed. It showed a recurrence of cancer, and the patient later died. This is a stark example, but not an uncommon example of what happens.
No wonder he straight up just admitted that the insurance companies are a pain in the ass. I mean, if he had to experience that, bro, you can't. Like, this is what I'm thinking. If a doctor hasn't experienced the loss of a patient in a in a in a blatant way, because obviously, patients can obviously die from a variety of things, and a lot of those things are not in the doctor's control. But what I'm saying is, like in this scenario, he could have done something. Maybe not save her, but could have at least extended her life. But the fact that he was the the healthcare provider was basically being annoying, just to not say something else. Yeah, it makes sense why this guy would straight up just go that, yeah, insurance companies are a pain in the ass, because you can't do this, bro.
It's not always a discussion just between me and the patient, as it should be. It's an insurance company getting involved and deciding that the care that I think is necessary, the care that the patient thinks is necessary, is not necessary.
Is there a specific point you can trace back to when things started getting worse?
Certainly, the expansion of Medicare Advantage has made a massive difference for us.
Medicare Advantage, when private companies administer publicly funded insurance, has expanded widely. More than half of all eligible people now have one of these private plans.
With traditional Medicare, there's essentially no prior authorization. When Medicare Advantage takes over, now we introduce significant prior authorizations.
These private for-profit insurers that run Medicare Advantage, they are absolutely in a league by themselves. And the denials are, to my mind, completely capricious.
Data shows
When they say what they're talking about is basically Obamacare, right? It's this system of basically forcing people to buy private insurance instead of the traditional public insurance.
that Medicare Advantage insurers denied about 7% of prior authorization requests. According to a 2024 Senate report, denial rates were much higher when it came to things like rehab and post-op care. The Wall Street Journal has been investigating Medicare Advantage for the last year.
This year, the journal has actually spent a lot of time looking at things that really aren't.
They've been investigating them. My question is, have they been have they been have they encountered any form of obstacles? Let's just say it. Let's just call it obstacles, but you know what I mean. Th- th- Obviously, obviously the people in charge of these insurance companies are more than likely the same people who control the economy. So I'm just saying, Wall Street Journal is still a private company, and if they want to keep their privileges, I'm wondering how far their investigation was allowed to go.
Part of the front door that are kind of behind the scenes. One of our stories looked at the prevalence of diagnoses in Medicare Advantage that did not actually come from a doctor treating the patient. They actually were added to the patient's records through activities associated with the insurer. So, to understand Medicare Advantage, one thing you have to understand is that the insurers that work in Medicare Advantage are paid more if the person that they're covering has more health conditions. So there's a strong incentive for Medicare Advantage insurers to document more diagnoses, things like diabetic cataracts or morbid obesity. It doesn't mean those diagnoses aren't true, but there is a greater payment for the insurer if they document more diagnoses.
So they basically, oh my goodness. So they try to squeeze out as many illnesses off of someone as possible. Chest pain. What? Okay, okay, hold on. Chest pain is sounds vague. Is it as vague as it sounds? Is my question. When they say chest pain, they don't actually mean just chest pain, right? That'd be ridiculous. But as I was saying, so these guys are just exploiting, trying to add to someone's record as many illnesses as possible, which in theory is a good thing because that means that the person is getting as many diagnoses as possible. Like it could potentially save their lives. But at the same time, if things such as just chest pain are added to their bill, and maybe I don't know, I'm overstretching here, but let's just suggest that perhaps they're just sore, or they have like a muscle torn in their chest or something. Like that seems so scummy. I mean, in theory, it could be an excellent system, but I don't know. I don't trust the when money is involved. Never rely on generosity.
Diagnoses. Insurer driven diagnoses in 2021 generated $8.7 billion in payments for United Healthcare, and that was the most in that year of any insurer.
In response to the journal's previous reporting, United Health has said that Medicare Advantage provides better health outcomes and more affordable healthcare for millions of seniors. When reached again for comment, they pointed us to recent changes the company has made to streamline the prior authorization process. America's Health Insurance Plans, an industry trade group, said in a statement to the Journal that providers and drug makers also share in the responsibility to patients, and that health plans work to protect patients from rising costs.
So I think insurers are do see themselves.
I mean, let's be real. Technically speaking, insurers do protect you from rising costs only because they're only because they are also rising their costs, but at a slower rate than the general market. Like for instance, if you go to a hospital, like what it was, how much is an ambulance again? 1,500? If you have an insurance provider, it's gonna be way less. But let's be real. You're paying that insurance provider monthly, and that bill is increasing year over year, month over month, little by little. So even if they're technically saving you money, they are technically making more off of you.
And it is true, as one of the few players in the system whose job is to try to tamp down those costs. However, the costs continue to rise.
I think it's important that there are checks and balances. The real problem is that what was intended to be a nice check and balance has turned into a way of penalizing physicians and patients in order to increase profits for shareholders.
The universal feeling is that insurance companies are working against us, against what we want for our patients, what our patients need.
And is there proof that that's not the case? Does anything suggest that these guys are not looking to exploit as much, like get as much money off of you as possible, no matter the consequence? I don't know, man. All I'm saying is people say that the government shouldn't have to take care of you. Well, that is true, but then the question becomes, so does that mean you trust more on a corporation than you do the government? I mean, personally, I don't know. Both the government and corporation seems scummy, but if I were to choose one, I think when it comes to health, I think the government's probably more reliable. A corporation, especially if a corporation relies on you getting sick for them to make their money. At least a government needs citizens to be exist. So that's why. That's at least that's my logic.